Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Welcome back to another episode of the Tongue Tie Experts podcast. I'm your host, Lisa Paladino, certified nurse midwife, IBCLC, and tongue tie expert. Whether you're a parent or a professional working with breastfeeding families, I'm here to provide insights and evidence-based information to help you navigate the complexities of infant care. Today, we're diving into a topic that has stirred a lot of debate in recent years: swaddling. Swaddling is an ancient practice that's still widely used today. But as more research emerges, professionals like IBCLCs, physical therapists, and occupational therapists are raising concerns about its potential negative effects, especially when it comes to breastfeeding and infant development. In today's episode, we will explore why swaddling has become controversial and why some specialists don't recommend it. First, why is swaddling controversial? Swaddling is often seen as a comfort practice. Many parents believe it helps babies sleep better, reduce fussiness, and even keeps them safe by preventing them from waking themselves up with sudden movements. But here's where things can get a little tricky. While swaddling can indeed provide short-term benefits like calming a baby or extending sleep, there's a growing body of evidence suggesting that it may actually interfere with key aspects of infant development. These include breastfeeding, the development of motor skills, and integrating of newborn reflexes. For lactation consultants and infant care specialists, the controversy stems from the tension between what seems like a quick fix for sleep and the potential long-term effects it might have on feeding. On top of that, as we have learned more and more about infant physiology and reflexes, The risks associated with over-reliance on swaddling have come into sharper focus. In this episode, we'll break down 5 reasons why swaddling is not always recommended by professionals who work closely with babies. But before we get into that, let's take a step back and look at the history of swaddling and why it's such a popular practice among young parents. I think looking at the history is important for us to understand so that we know why there are such strong feelings about it. Swaddling has been around for thousands of years. In fact, the practice can be traced back to ancient civilizations like the Greeks and Egyptians. Back then, babies were wrapped tightly in cloth to keep them calm and restrict their movements, which was believed to prevent injury or help them grow straight and strong. Swaddling was part of a cultural norm in many societies, used as a way to soothe infants, especially in environments where parents had to work or had limited time to hold their babies. Fast forward to modern times, and the practice faded in some regions of the world, particularly in Western countries. However, in recent decades, swaddling has made a resurgence, largely thanks to modern parenting trends that emphasize sleep training and baby soothing techniques, and I suspect even formula feeding. But I won't get into that controversy. Books, online resources, and even pediatricians often recommend swaddling as a solution for parents struggling with fussy newborns or short sleep cycles. Hospitals routinely show new parents how to swaddle before they're discharged with their babies, reinforcing the belief that it's essential for good infant care. Back in the 90s, when I worked as a nurse in the infant nurseries, we definitely prioritized swaddling. We actually gave bragging rights to the best swaddler. Why? Because the vast majority of parents were not breastfeeding. And even if they were not rooming in. Rooming in was a rare event. So the babies were all in the nursery with us. And I worked in a busy nursery where we often had up to 14 babies with most of the time 2 of us to care for them. Sometimes we had a third assistant, but mostly it was on us. That meant 3 bottle feedings per shift for each child. We had no time for soothing in between. Those babies needed to be fed on a schedule. I can dive into the harm of those practices in another episode, but for now, suffice it to say that swaddling was helpful to the nursing staff and our peace of mind. I wish I could go back and apologize and do things differently, but as I often say, you know better, you do better. But let's get back to why young parents think it's important. The short answer is sleep. Swaddling is often marketed as a tool to help babies sleep longer and more soundly. Speaking of marketing, there's so many different swaddling tools to buy, so many different wraps and blankets that claim to be the perfect swaddler, right? And sometimes they're adorable too. I don't blame parents. With the pressures of modern life, particularly for parents balancing work and family, getting baby to sleep well becomes a priority. The fear of sudden infant death syndrome also plays a role. Many believe that swaddling helps keep babies on their backs, which reduces the risk of SIDS. While actually, the evidence of swaddling and SIDS may contradict this. This combination of perceived sleep benefits and safety concerns makes swaddling feel like a must-do for many parents. However, despite these perceived benefits, real or perceived, there are growing concerns among healthcare professionals about what happens when swaddling is overused or when it interferes with natural infant behaviors, especially in the context of breastfeeding and physical development. Now that we've covered a bit of the history and why swaddling is still so popular today, let's move on to the 5 key reasons why specialists like me, including IBCLCs, physical therapists, and occupational therapists, chiropractors, etc., often caution against extended swaddling. Reason number 1, interference with breastfeeding. Swaddling can seem like a simple solution to soothe a fussy baby, but it can interfere with breastfeeding, and here's why. Infants use their hands to help guide themselves to the breast. You may have noticed that newborns have an instinctive ability to find the breast using their hands. This is often called breast-seeking behavior. They reach out, they grasp, they pinch, they bring their hands to their mouths, activating important reflexes that help them latch. When a baby is swaddled, their arms are pinned down, which makes it harder for them to latch properly and efficiently, even when they're unlatched, because they spend so much time with their hands restrained. Many mothers who are experiencing challenges with breastfeeding don't realize that the swaddle may be contributing to the issue. Without access to their hands, babies can't follow or show us their natural feeding cues. As a result, this can lead to frustration for both the mother and the baby, potentially resulting in infants sleeping through feeding because they are just so comfortable, which in turn can affect infant intake, weight gain, and milk supply over time. So keeping those hands free can really enhance the breastfeeding experience and set the stage for success. Reason number 2, disruption of reflex integration. Let's talk about reflexes, particularly the newborn reflexes that are so important for early development. Newborns are born with a set of primitive reflexes that help them survive and thrive in those first few months of life. The rooting reflex, for example, is when the baby automatically turns their head towards a touch on the cheek, helping them find the nipple. The grasping reflex helps them hold on to things like a caregiver's finger, or in this case, the breast. When an infant is swaddled, these reflexes can be disrupted. The body isn't able to practice integrating those movements, and over time, swaddling can prevent babies from developing the motor control they need. Specialists like occupational physical therapists and chiropractors and other body workers or manual therapists emphasize how crucial these reflexes are for neurological development. If we inhibit these movements early on, it can delay important milestones like head control and self-soothing and being able to sit upright and being able to turn over, etc. Reason number 3 that I don't recommend swaddling is the startle reflex and self-regulation. So in reason number 2, we talked about reflexes in general. Now let's go deeper about reflexes and talk about the Moro or startle reflex. This is an important reflex that helps protect the baby from sudden changes in their environment. You might see this when a baby is startled by a loud noise or a quick movement. They fling their arms out wide, then pull them back in. Many parents swaddle in hopes of reducing this reflex because it can wake babies up during sleep. However, suppressing this reflex through swaddling isn't always the best solution. The Moro reflex is actually helping your baby learn to self-regulate. Over time, as the nervous system develops, babies learn to calm themselves when they experience this startle, which is an important part of learning to sleep longer without external aid. By swaddling, we might be stopping the reflex in the short term, but we're also delaying a baby's ability to self-soothe and regulate their response to stimuli. It's a bit like putting a Band-Aid on the problem instead of allowing the baby to learn to manage it naturally. In other words, if a baby always needs to be swaddled because they startle when they aren't, if we keep doing that, they will never integrate the ability to be at rest without easily swaddling. They'll never integrate that reflex. We're up to reason number 4, restriction of natural movement. Movement is a big part of infant development, and swaddling naturally restricts this. From birth, babies are learning how to move their bodies in response to their surroundings. Simple actions like stretching their arms or kicking their legs help them build strength and coordination. Think about how a baby eventually learns to roll over or push up on their hands and knees. These movements start as small exploratory motions in the early weeks. When a baby is tightly swaddled, it obviously limits their ability to move freely, which can delay the development of their motor skills. Physical therapists that I know emphasize the importance of babies having tummy time and allowing them the space to practice these movements. Long periods of swaddling can mean missed opportunities for babies to naturally stretch and strengthen their muscles. Over time, this can affect their ability to reach developmental milestones like rolling over, sitting up, and even crawling. Reason number 5 that I don't recommend swaddling: long-term impact on sleep patterns. Finally, let's talk about sleep. It's no secret that swaddling can help some babies fall asleep faster in the early weeks, but over-reliance on swaddling can have a negative impact on long-term sleep patterns. While it might seem like a quick fix to get a baby to settle down, swaddling actually prevents babies from naturally finding their most comfortable sleeping position. As they grow, babies need to learn how to move freely in their sleep, adjusting their position for comfort and safety. If they're swaddled tightly, they can't practice this natural movement. And when the time comes to transition out of the swaddle, many babies may struggle to sleep without it. This can lead to disrupted sleep and an even more challenging transition to a more natural sleep routine. Moreover, keeping a baby swaddled can mask underlying issues that might be affecting their sleep, like poor feeding patterns, discomfort, or tongue tie issues that go unnoticed when the focus is solely on getting them to sleep longer. So there you have it. 5 reasons why specialists like IBCLCs and other tongue tie experts may caution against swaddling, especially when it comes to breastfeeding and overall infant development. To recap, swaddling can interfere with breastfeeding, disrupt reflex integration, restrict natural movement, suppress the startle reflex in unhealthy ways, and negatively impact long-term sleep patterns. If you are working with parents who are considering swaddling, it's important to provide them with this information and encourage them to allow their babies to move freely. While swaddling may offer short-term benefits, the long-term impacts on feeding, development, and sleep should be carefully considered. As always, I never tell parents what they should do. I present them with education and all the information that's at my fingertips. I share that with them and help them make an informed and educated decision. I hope this discussion has provided valuable insight into the complexities of swaddling and its effect on breastfeeding. As always, I'm here to support professionals in their journey to help breastfeeding families thrive. As always, be sure to subscribe, leave a review, and share this episode with anyone you think could benefit from this information. Until next time, thanks for all you do for the families in your care. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.